Have you got it yet?
Yes, I do. Thank you very much. Good afternoon, everybody. This is the Vermont State Senate Committee on Institutions. I'm Joe Benning, the chair of the committee. We have along with us Senator McCormick from Windsor County, Senator Mazza from Grand Isle, Senator Parent from Franklin County, and Senator Ingalls from Essex Orleans. We are continuing our conversations this week of simple introductions of the players that fit into the Capitol bill in one form or another. And again, I'll remind everybody that may be watching this on YouTube, you do have the ability to comment on YouTube, but I would just remind you that this is a family-oriented situation, and we would appreciate it if you would keep that in the back of your mind should you choose to be making any comments. With that, I'm going to start today with our first witness, Sarah Squirrel. Sarah and Morning, while you are also on the line, these are basic 50,000 foot level views of how you fit into the picture. What I'm asking for the benefit of the three members who are new to this committee is that you introduce not only yourselves and give us a brief biography, but also how you, what position you hold within government and how you fit into the Capitol bill. We will open it up then for questions just to make sure everybody is familiar with what you do and how you will be coming back to us and asking for allocations. So for the time being, let's start with Sarah. Welcome.
Thank you, Senator Benning. For the record, Sarah Squirrel, Commissioner of the Department of Mental Health. So nice to meet some of the new senators and see some of the folks from last year. I can share a little bit about my background. As Senator Benning indicated, talk at a very high level about the work of the Department of Mental Health, and then of course, how it fits into the Capitol bill for this year. So I have worked in community mental health for most of my career. I actually started working in direct care service at Washington County Mental Health, working in an adolescent treatment facility. I then worked in school-based mental health services for over a decade in Lamoille and Caledonia County. So that was providing comprehensive school-based services to children and youth in their public schools who had significant social, emotional, and behavioral needs. And then from that point on, have been involved in various leadership positions across the state. I was the founding executive director of the Vermont Cooperative for Practice Improvement and Innovation, which is a program that focuses on implementing best practices across the state in the adult mental health system, and successfully ran that organization for about 3 years. I was also the executive director of Building Bright Futures, which is an organization that supports early care and learning across the state. Was a great opportunity to become more involved with the legislature and policy development. And it was almost 2 years now that I became the commissioner of the Department of Mental Health. So that's just to give you a little bit of background on me. Also, if anyone's interested, I was a Laker. I did grow up in Colchester and went to school there.
Sorry about that.
Thank you.
You're welcome, Senator Mazza. And just, I mean, at a high level, the Department of Mental Health, obviously with the impact of COVID on the state and the pandemic, ensuring that Vermonters have access to high quality mental health care has been a tremendous priority from our perspective. And I think really speaks to why we, in collaboration with the legislature, need to continue to work to address the mental health needs of Vermonters. We work collaboratively with many community mental health agencies across the state, providing community-based services. We also work with designated hospitals across the state who are providing inpatient care. And then where you might be interested is in our facilities. So we run the Vermont Psychiatric Care Hospital, which is a 25-bed hospital in Berlin, as well as the Middlesex Therapeutic Community Residence, which is a 7-bed residential facility located in Middlesex. And that's probably a good segue into where the Department of Mental Health will be intersecting with your committee for this session related to the capital bill. The Middlesex Therapeutic Community Residence was established post-Hurricane Irene. So when we lost the Vermont State Hospital, as part of that crisis response to ensure that the highest acuity Vermonters could still access mental health care, we established the Middlesex Therapeutic Community Residence. It's a 7-bed secure residential facility, meaning that it is secured by a fence. And that is to ensure that we're able to meet the clinical and safety needs of residents who receive care there. That was designed to be a temporary facility. We were able to utilize FEMA funds to construct that facility, and the facility has certainly outlasted its lifespan. Some members of this committee have been able to visit the current facility. It is essentially 2 trailers that have been artfully put together and maintained by Buildings, Grounds, and Services. But replacing MTCR has been a top priority of the Department of Mental Health and the administration. We have previous capital funds that have been approved to move forward on a new physically secure recovery residence. We already received an appropriation of $4.5 million. I would anticipate that we will have an additional request for capital bill dollars to bring that construction to fruition. We are proposing a new 16-bed physically secure recovery residence. The location that we are currently looking at is the old Woodside site. The Essex parcel is the current location that we are looking at to construct that. We are well on our way in terms of work around design for the facility. Deputy Commissioner Morning Fox can talk a little bit about that design work. And we are ready to move forward with construction of that facility. In terms of what that means for our system of care, you may be aware that we have level 1 beds across the state of Vermont. Those level 1 beds were the old Vermont State Hospital beds, really designed to meet the needs of those individuals who have the highest acuity across the state. And one of the challenges that we currently have in our system is flow. Meaning and referring to our ability to transition individuals from higher levels of care, such as inpatient, to lower levels of care, such as residential. The Middlesex Therapeutic Community Residence is critical, and 95% of the referrals to that residential facility come from our level 1 beds. So in order for us to successfully move Vermonters from those level 1 beds back to the community, we really need to expand that resource, which is why we are proposing a 16-bed facility. We have done extensive work with stakeholders, and that work is continuing as we speak. And we are anticipating that the future physically secure recovery residence will be a state-run entity and will provide an estimated 70 or more state jobs. So I can probably leave it there for now, if that seems adequate, Senator Benning, and turn it over to Deputy Commissioner Morning Fox.
Well, nice try, Sarah, but I'm going to back you up just a little bit.
Sure.
This committee has new members who have never been involved in a discussion that involves words like acuity and level 1. In addition, we are now on YouTube, which presents a potential audience of folks who are also kind of on the edges of understanding some of the vernacular that is constantly used. I'm wondering if you could do a couple of things, and maybe Morning wants to do part of this as well. But we would like to hear some basic information about the different levels that may be addressed in some of these facilities. And I know that we have a report that's come out about plans on moving ahead, but I'd also like to have you bring the committee up to speed on where we've been and why it is necessary that we move in a different direction from where we have been. I don't know if I've been clear as mud, but hopefully that gives you something a little bit more to talk about.
Yeah, sure. I'm happy to. I can start that off, and then maybe Deputy Commissioner Morning Fox always fills in the blanks for me and corrects me where I've got something wrong. So when we think about our mental health system of care, we really do think about it as a continuum of care, from promotion, prevention, early intervention, treatment, and recovery. So when we think about the prevention aspects of that, obviously our mind immediately goes to our youngest Vermonters. And so our efforts to really work in the communities to support young children and their families, particularly young children in their social, emotional, and behavioral development. Many of our designated community mental health agencies across the state have robust child, youth, and family programs. We have robust programs within the public schools so that as children are accessing their public education and we're noticing and becoming aware of some of those social, emotional, and behavioral challenges, we can intervene as early as possible. That has been a huge focus and energy on behalf of the department. As we move up in terms of need, we think about more targeted services and supports. We think about services and supports in the community for adults. That could be outpatient needs. When we say outpatient, we mean counseling services, case management services that an individual might need to access depending on their mental health needs. As we continue up in terms of acuity, we also think about individuals who might be experiencing a psychiatric crisis. So this could be a child or a youth, it could be an adult. And typically the point of entry into that more acute system is through our emergency departments or screeners. So for example, if a child or youth is experiencing a psychiatric crisis, they may be screened by one of our qualified mental health professionals across the state. They would go to the emergency room where they would await placement in one of our inpatient facilities across the state. One thing to keep in mind for children and youth in particular is that our only inpatient capacity is at the Brattleboro Retreat. So that is where those children and youth will receive their inpatient care and treatment. On the adult side, it can be a little bit more complicated, where we have individuals who might be experiencing a psychiatric crisis, who may go through the same process of being screened in an emergency department, and then they would receive their inpatient care at one of our designated hospitals across the state. And, you know, that could be the Brattleboro Retreat, it could be UVM, it could be Central Vermont Medical Center. We have several designated hospitals across the state where you can receive inpatient treatment. Where it gets complicated is that you can have different legal status. So you could be a voluntary patient who is seeking inpatient care of your own accord, or you could be involuntary, meaning that because of your elevated safety and mental health needs, you are placed under the care and custody of the Commissioner of Mental Health, and then we are responsible for overseeing your care in an inpatient setting. And we also have individuals under the care and custody of the Commissioner who are also in the community on orders of non-hospitalization. So a network of providers across the state. And then when we think about that continuum, we think about our residential services, and that would be kind of a step down from inpatient. So inpatient services are really designed to treat acute psychiatric distress, to assess, and then to think about how do we transition that individual back to the community. That could be a direct transition back to the community with support from your community mental health agency, who might have enhanced substance use services, job support services, et cetera. For children, it can also mean additional supports and wraparound supports in the community. For some individuals, you may need to step down to a lower level of care that's not quite at the community. So that could be a residential setting. The Middlesex Therapeutic Community Residence is a residential setting. So it's really designed for longer term stays than maybe an acute inpatient setting where you're receiving ongoing clinical treatment and support, daily living skills that will help facilitate you being successful back in the community. We have a network of intensive recovery residences across the state. many whom are run by our designated community mental health agencies and other residential programs, both for children and adults. So if you are stepping down from inpatient level of care, there are a whole host of residential programs across the state. So I will pause there. That's just intended to give you a little bit of an overview on the continuum and where folks may fall in that continuum, what services are available in the continuum. And it really is critical that at all levels of care, we have adequate capacity, which is why the expansion of the Middlesex Therapeutic Community Residence is such a priority for us right now. So I will pause there.
Other than Morning, who will introduce himself in a moment, can you tell us generally about the staff that you supervise, be they either direct state employees or partners in some fashion?
Yeah, that's a great question, Senator Benning. Thank you. So our overall budget for the Department of Mental Health, just to give you a sense of the breadbox of our budget, is about $266 million. We do have about 300 staff here at the Department of Mental Health that we directly oversee, if you will. We have about 60 to 70 in central office. So that is our business office, our adult services, our children's services, our policy team, our care management team, et cetera. Most of our staff, the bulk of our staff, I think about 260 are at the facilities. So that's the Vermont Psychiatric Care Hospital. That's mental health specialists, nursing staff, quality staff, recovery staff, therapeutic staff, social work, working at Vermont Psychiatric Care Hospital, in addition to staff at the Middlesex Therapeutic Community Residence. Again, mental health specialists, social work, directors of the program, et cetera, that we directly oversee. I would just note that much of the work that the Department of Mental Health does is through contracts with other community partners. So for example, we contract with designated agencies and specialized service agencies across the state to provide those community-based services that I mentioned. With that designation, if you will, comes a lot of oversight. So while I do not directly supervise all of the employees of all the designated agencies, we'll use the Howard Center, for example. Those are employees of the Howard Center. The Howard Center contracts with DMH to provide those services. We do have a significant amount of oversight and authority related to the provision of services at the community level. We have a designation process that is very intensive. So again, we contract with community partners to provide services, a lot of oversight around that. The other thing I would just note as well, we do have designated hospitals that we also work with that provide inpatient care. Our designation authority, if you will, is not as robust for the hospitals as it is for the designated agencies and specialized service agencies. But certainly we provide oversight in addition to the Vermont Department of Health, Joint Commission, Centers for Medicaid Services that also have a lot of oversight of our hospitals as well for those inpatient units. And overall, we serve about 35,000 Vermonters annually through those systems.
So before I turn it over to the committee for questions, I have one really important question. You have a relative in that other body that shall not be named. Can you tell us who that is and how he fits into the picture?
Yes, so my father is Trevor Squirrel, who is a colleague of all of yours. He is also a legislator. He was previously on environmental committees, but this year he has been assigned to the House Appropriations Committee.
Committee, any questions for the commissioner? Senator Mazza.
Sarah, the new location you say at the Woodside will accommodate 16. Are you updating that facility or tearing it down, building a new one? And the other question is 16, is that going to be enough? Because you're going from 25 to 16, is that correct?
No, we're going from 7 to 16.
Oh, 7 in Middlesex now?
Yes,
Okay, it's up to 16.
up to 16. So we're
Okay.
expanding our capacity based on the data that we've looked at that indicates that how many individuals that could be served in Middlesex but are essentially not able to move. And yes, so the Woodside site is ideal from many perspectives. However, the facility itself is a correctional facility. That's
Right.
how it was designed. So our current plans are to demolish that facility and to build therapeutic trauma-informed residence.
So you just use the land, the location then.
Yes, that's correct.
Oh, good. Okay, good. Thank you.
Yep. Our plan is there is a gym there, and our current plan is to keep the gym and continue to use the gymnasium for programming for the new residential facility.
It seems though your department is getting more and more requests for the mental health, and it seems to be growing every time you read the paper, listen to the news. There's always more services needed, and I just the future looks like it's going to grow all the time, right? It's there's more services needed every year, isn't there? Or...
Yeah, I think that's correct and accurate. And given the impact of COVID that is having on Vermonters, we know that we're going to continue to see the impacts of the pandemic. And I think what we hear from our designated agencies is, a lot of demand for services, a lot of demand for crisis services, and agencies seeing individuals they've never seen before.
Right.
So individuals who are probably managing okay on their own previously are now reaching out for help. And we've certainly moved very fast to try to implement additional resources for Vermonters, but my sense is that we will continue to see the impact of COVID on Vermonters' mental health.
Good job. Thank you.
Committee, any other questions? Commissioner, thank you very much for joining us. I am going to assume that since you are the top dog, so to speak, we'll be seeing much more of Morning than we will of you as the months go by. I don't know if that's true or not, but Morning, welcome aboard.
Thank you, Senator. Appreciate it. For the record, Morning Fox, Deputy Commissioner, Department of Mental Health. Senator McCormick, good seeing you again. Senator Mazza, you were there, but was good seeing you again, as well as you, Senator Benning, and nice to meet you, Senator Ingalls and Senator Parent. So a little background on myself. I've been deputy for the Department of Mental Health now just shy of 4 years. I grew up, or how I describe it, I grew up in the field 25 years ago doing psychiatric crisis work for the Howard Center, doing mobile crisis work, seeing people in the community, emergency rooms, things of that sort. I kind of progressed up the line, if you will, to overseeing some of the programs at the Howard Center. I got involved with doing a lot of work with the courts in Chittenden County, doing court screenings. That led me to connections with other law enforcement folks, eventually led to some training that I've gone through and continued with around hostage negotiating, crisis negotiating with Massachusetts Department of Corrections, as well as the Federal Bureau of Investigations. I did work in Massachusetts for about 10 years where while there I was the director of the maximum security units at Bridgewater State Hospital, which is a Department of Corrections run hospital for lack of a better term, the criminally insane, if you will. And so I ran their maximum security units there for about 5 years. I've also run community private general psychiatric inpatient units as well. After being in Massachusetts, I returned to Vermont, as that's where my kids and grandkids are. Well, some of them are still here. Others are moving on. But my wife and I moved back to Vermont. I was the Director of Behavioral Health for Lamoille County Mental Health up in Morrisville, and then came to work at the department back in 2013. So that's me in a nutshell from a work perspective. I did do a little bit of work out in Indiana for my alma mater, and I just have to speak of my alma mater because there are at least a few other folks from my small liberal arts college in the Midwest who are in the legislature. I went to Earlham College, a small place known for folks like Representative Lippert. So he and I get to enjoy some of those conversations of the time that we were there, which we're separated by about probably 15 years or more. So not that we crossed paths, but so that's me. In picking up on some of the pieces too, I just wanted to clarify. I know Senator Benning, you asked about the term level 1, and when Commissioner was speaking, talked about we have voluntary folks, we have involuntary folks, and then there's also what's called level 1, as you mentioned, and level 1 really came about or was created, if you will, by you all, by the legislature, back after Tropical Storm Irene flooded the Vermont State Hospital. And at that point, we then worked on developing basically what we call a decentralized state hospital system, where part of the result of Tropical Storm Irene was the creation of the Vermont Psychiatric Care Hospital with those 25 beds. But we as the department, we also contract with Brattleboro Retreat as well as with Rutland Regional Medical Center for an additional 20 beds, giving us a total of 45 beds that we consider level 1. And really for almost every discussion, you can really equate the term level 1 to mean state hospital level of care. Folks who tend to be needing the most support services and have the highest acuity, if you will. And acuity is kind of a measure of how well a person is doing, how easily they are to work with, how safe they are to work in an environment, things of that sort. And so the level 1 is considered, was an attempt at basically saying these are folks who would have traditionally in the past gone to the Vermont State Hospital. At the time of the state hospital flooding, there were 54 patients there. And so throughout the years, we basically have put together 45 beds to try and come back to matching some of that need. But there were also a number of folks who were at the state hospital at that time that really did not require hospital level of care, if you will, but because of the nature of their illness, because of some of the security issues and concerns, public safety concerns, et cetera, they had not been discharged from the Vermont State Hospital at that time. And so that was also a part of the rationale of having a secure residential, the Middlesex Therapeutic Community Residence, which was for some of those folks to have a place to work on that community integration. And really what it's for is for those folks who no longer really need hospital level of care, but require extra support services, extra security to provide them the capacity and the space to work on transitioning back into the community in a safe fashion. And so I've been very busy. Part of my work has been working with the architects, the design teams, the folks from BGS around the design of the future secure residential. And we're actually at a place now where we're finishing up the schematic designs, where we're actually starting to see some 3D renderings of the facility. We have brought in stakeholders early on into this process, having meetings, having the architects and design teams present the information just around the basic concepts and blueprints of the design, everything from room sizes to types of rooms that we're going to have, special spaces for certain programming, things of that sort, down to what the exterior siding will look like and things of that sort. And so that work is ongoing, but you're right, you will probably be seeing myself and Commissioner Squirrel coming and talking about where we're at with that design and what the next steps are and what we need from the capital bill to be able to see that through to fruition. Let's see. Well, I'll stop there, and if there are questions, I will answer and go from there.
Morning. What issues are there that are on the horizon which we have yet to talk about? We've gone through a lot of conversation about where we were with Irene and then through the process of trying to redevelop a system. Last year, we were talking about the immediate concerns for construction. But what else is out there on the horizon that you think may be coming down the pike?
Interesting question. I appreciate the opportunity to speak to what do I see coming down the pike in the future. Well, clearly, this work here. Also, this committee had been involved also with capital funds to help the department work with the Brattleboro Retreat to expand their bed capacity as well in the level 1 arena, if you will. And it's our hope that we're going to be seeing those beds actually coming online in just the coming months now, as that construction is just now being completed, and we're now working with them on staffing patterns and basically ramping up so that they can have their opening and open up those new beds at the retreat. I think we've talked about other types of facilities or issues or places, and just one that I've spoken about before that I wouldn't be surprised if it comes up again at some point, whether it's this session or another, is our forensic population. That a significant percentage of the folks at the Vermont Psychiatric Care Hospital are what are considered forensic in nature, that they've come into the mental health system through the criminal justice system. And Vermont has done a tremendous job in leveraging federal funds, Medicaid, CMS funds, to be able to operate and have as minimal an impact on Vermonters and the tax base here in our state to run a 25-bed, $20-some-odd million psychiatric care hospital. Having a forensic population that's kind of in conflict with CMS participation and monies coming in for us. And so we're starting to have some conversations around that, what that spend down would look like, and what the impacts would be. Vermont is an outlier compared to almost every other state in the country as far as having a forensic system of care, if you will. And I think that's what we're, Commissioner Squirrel and myself are looking to try and help develop in the state, is a better system of care for the forensic population. And that includes everything from oversight in communities, partnerships with corrections, probation, parole, community providers, as well as public safety. And that's what it part of it comes down to, especially when we start talking about institutions and facilities, is where might some folks go? They're right now it works fine to go to a state hospital if someone is found not competent or not sane in a criminal court case, and we treat them, and that's not the issue. The issue becomes when they no longer require hospital level of care, then where do they go? Because our funding is tied to people receiving active treatment. So I think that's a conversation that I can imagine seeing come down the future.
So your forensic population is coming through our judicial system, which is almost virtually shut down due to COVID. Have there been hiccups in trying to reach the population quick enough?
I think early on, we did a lot of work with the court systems and chief administrative judge to get hearings set up. And so we're still seeing people come into our system through that, because the courts are bogged down because of COVID, but they're still having their arraignments and initial judicial hearings. And that's generally where the questions of someone's competency come up. And so it's at those points that people are still being referred to or ordered into the care and custody of the commissioner for competency. So we're still receiving those folks. I think the trickier part is the resolution of that. Again, working with the courts and trying to make those happen. But we've been able to develop good virtual court procedures for our hospitals as well as the courts. And so I would say that there were some initial concerns, but the overall impact of COVID as far as court hearings, things of that sort, hasn't been as bad as we might have expected.
Okay. Committee, questions? Senator Ingalls, I see you moving your
Yes.
hand. Sure, go ahead.
Thank you, Deputy Commissioner. As Commissioner Squirrel had said that the caseload has climbed, and you've touched upon that, probably not as much as what you thought it might be because of the capacity of the courts are non-existent. But have you rose enough to where your budgets of last year you're going to be requesting more money this year?
It's a great question, Senator Ingalls. And certainly at this point, we can talk about policy as it relates to the DMH budget. Certainly, I can highlight a couple areas that have allowed us to be responsive to the increased needs that we're seeing. One of them was our implementation of payment reform at DMH for all of our community mental health agencies. So we were able to implement an alternative payment model for those agencies where we pay them prospectively for services and treatment. So all of our designated community mental health agencies, for example, get their monthly prospective payment based on historic data in terms of number of individuals served, et cetera. We've been able to continue those prospective payments with a lot of flexibility on the back end from Medicaid, because what we actually saw, of course, when COVID first impacted the state was a dropping off of services, and then we had a workforce shortage. Fortunately, that did not result in extensive economic hardship to those community providers because we had payment reform in place. We've also been able to leverage the coronavirus relief funds to also support our designated community mental health agencies, as well as our designated hospitals, who have also benefited from those federal funds. So Vermont was very fortunate to receive a large amount of federal funds. So together with those things paired together, I think we've really done a tremendous job of supporting our network of mental health providers, and we'll have to continue to monitor the impacts of COVID. We also have been in receipt of several significant federal grants. And typically we will provide that funding to our community mental health agencies so they can expand services. So again, we're always looking to also leverage those federal dollars that come into the state. We are getting a sense right now that our mental health block grant will likely be increased, which is another funding source for the Department of Mental Health. So those are just a few areas that I would highlight from a fiscal and policy perspective.
Thank you.
I think that's a very artful way of saying yes.
Maybe.
Other questions? Sure, Senator McCormick.
Thanks. Not so much a question, just a greeting. Mr. Chairman, you mentioned that you have several new members on this committee, but I served on health and welfare for several years previous, so that it's good to see two old friends again. That's all.
Good to know.
Yep.
So you both work in very, I guess, in an area of the state that is very high stressful. I'm curious, what do you do for fun on the side?
That is a great question, Senator Benning. Thank you. Well, my go-to wellness strategy, if you will, is running. So I'm an avid runner, although I can't run any races right now. I probably run anywhere from 25 to 30 miles a week. So that
Wow,
to me is,
that's a lot by car.
that's a lot. I can't go anywhere in my car now, so I have to run. So that to me has been huge. And then I have, 2 children, and of course they are just pouring my extra energy and attention into them. They're both in middle school right now, is also a big part of my wellness plan, and having that good work-life balance.
And I guess I would answer that in that, I've got 5 grandchildren. No, sorry, 6 grandchildren. And so that's generally a great de-stressor for me, being able to just be with them. But I'm an improvisational comedian, and haven't performed in about a year. And so I'm really waiting for COVID to end so we can get back onto stage and do some performing. That, to me, doing comedy on stage is it's my therapy. And with improv, there's no planning, there's nothing I need to remember, and whatever comes out of my mouth, I just got to deal with it and make sense of it. And so that's really, and it's actually been a philosophy of life, doing improv. I met my wife doing improv. It's kind of the cornerstone of our marriage. The main rule of improvisational comedy is yes and. There is no no's. You always say yes. There's an artful way of saying no by starting with yes. And so that's a life philosophy of mine. And then I try to always get outside. Yeah. Definitely. And then I always try and get out into the woods. I'm an avid Frisbee golfer, which is just a creative way of getting myself out into the woods and taking a good 2-mile hike on a regular basis.
So I don't have any grandchildren yet, but is it true what they say that the most fun part about having them is to wind them up and send them back home?
Best thing in the world is to go, here's some chocolate, here's $5, I'll see you later.
Hello, Uncle Candy first. Okay.
Yeah, exactly. And get to buy all the loud presents.
Committee, any other further comments, questions?
I just want to say that the best thing about being a grandparent is that you can say, the child no longer amuses me. Take her.
I'm done.
Thank you very much for coming out and joining us this afternoon. We will be seeing you in the not too distant future, I understand. So thanks and have a great day.
Thank you.
You all. Wonderful
Committee?
to see you all.
Thank you for having us.
Committee, just for your edification, we had a third witness who has canceled. And I guess that means you're all off the hook. But before we leave as a committee, Denise, I'm going to ask to go off you